We've got our time set aside for your healthcare partners, brought to you by GRMC, where patients are partners. And we've got a whole set of new faces in the studio this time around. And welcome for the to Cindy Hansen, to the GRMC family. Good morning. I'm so glad that you're here. I get to see your face every Monday now. That's fantastic. Okay, let's start with Dr. Let me get your, because I'm everything on you, Mr. Greg, okay? Dr. Cheruvu, how are you? Here we go. Hematologist and medical oncologist at GRMC. And then we've got Rowena Dimdimin? Yes. Dimdimin?
Yes.
Wow, okay. Where's that from? That
Philippines?
Yeah. Okay. And then we've got Greg.
Woodard. I'm a nurse practitioner. I work in the oncology clinic.
Fantastic. It's nice. How do you spell your last name, Greg?
Wood ARD.
Oh, okay, Woodard. Okay, got it. Well, it's nice to have you in the studio. And welcome to a segment dedicated to the fine services at GRMC. I've got to ask you, how many hematologists do we have on Guam? This has been a really big deal, not to have one for a long time.
I think there's 4, including me.
Okay, and so why would someone get into that specific field? What was the attraction to you?
So the hematology, the broader thing is the oncology. It's a combined fellowship, oncology and hematology. Mm-hmm. For me, different people have different reasons why they get into it. But for me, it's because the strongest driving factor for me was when I was doing my residency, that's when I decided to go into oncology, because I really liked the patients, because cancer is such an overwhelming diagnosis. But then all the patients that I encountered, they seemed to put up such a big fight, such a graceful fight. And I felt like there was so much to learn from them about family, friendship, love. And then it helps you to have a perspective on your own life as an oncologist when you're dealing with all these patitions. It keeps reminding you.
I have never heard it explained that way.
You always get a reminder that life is short. There's really no reason to judge somebody, or no reason to fight with somebody or argue with somebody, because life is short. You just have to enjoy it. That's something I learned from my patients, and it actually gives me a lot of satisfaction treating my patients and talking to them.
I would say, and I think that everybody in the room would agree, that there was a time in our world history where we thought that getting cancer was the death knell.
Yeah. And yes, and I agree, there used to be that time, but it's not that death sentence anymore for a lot of cancers. We're treating them well. Some of them we're curing. Some of the cancer, the patients are able to enjoy a very good quality of life, even with chemotherapy. So it's not the death sentence that it was in the past.
In the past. Yeah. Rowena, what is your position at GRMC?
I'm an oncology staff nurse, actually. And then I was the first nurse to be hired from the Philippines to work at an oncology clinic.
Oh, lucky you got in. Right under the radar. And Greg, your position as a nurse practitioner?
So people receiving chemotherapy, sometimes they'll have toxicities, and I help manage those, like nausea, that kind of thing. I also see patients in follow-up who are getting active chemotherapy. And I work with Rowena and 2 other nurses.
Yeah, moving closer to the microphones, if you don't mind, because they're real sensitive, and they get, unfortunately, we have volume issues, because you guys come in, this is a profession that's not well known publicly. You don't speak publicly, so this is an opportunity to help us educate people on Guam about the kind of service that's offered at GRMC in that department. Is the oncology department a big department? Is it one of the bigger departments?
I would say it is. We are pretty busy. So it's me, the oncologist. We have 3 chemotherapy nurses. We have a nurse practitioner. We have 2 front desk staff.
1 MA.
We have 1 MA. Yeah. It's pretty big in GRMC.
Well, then it seems like, Greg, you're being run to the ground if you're the only NP over there. I mean, the service that you provide is valuable to the doctor who can't constantly be there for all of these patients, right?
Yes, that is very true.
Yeah.
He not only does, he not only sees patients, but he also works on getting our patients the drugs that they need. A lot of those drugs, the newer drugs, especially are oral drugs that come from the States. And we have some difficulty, some logistics issues with that, and he actually does a very good job getting those to the patients and, working on that. Yeah, so we really need him there.
Yeah, and probably more Gregs then as well. I mean, for the size of that.
Yes.
How many patients have you seen? Well, first of all, how long have you been on Guam?
6 months now.
Okay. Oh, my.
Time flies, yeah.
And so I'm sure you've had a lot of patients come through in 6 months.
Yeah.
Unfortunately.
Unfortunately, that's right. Because I find out that the cancer incidence is decreasing in the States, but not so in Guam.
Yeah.
It's actually going up. And the death rate from cancer is higher on Guam compared to the States.
And that is because of what? Is it because of the drugs or the treatment?
There's a lot of issues. Maybe there's not good screening practices here. We have a lot of patients with hepatitis C, hepatitis B who are at a higher risk for liver cancer. And I find out that either, I don't know where the problem is, but the screening is not there, and then they end up with liver cancer. If they're screened, they do get cancer, but the cancer is taken care of at an earlier stage.
Right.
And I don't know what the other reason could be. Not sure, but the cancer incidence is higher here. Yeah.
So I was going to ask you the magic question to what do you attribute? And it's difficult to say. We can't put and every oncologist I've spoken to also talks about that one nebulous area of environmental health.
Yes, that is true.
I'm sure you've studied the history of Guam and known just we've been exposed to.
Yes. Yeah, that could be the reason why.
Yeah. So the work that you're doing at GRMC is among how many other oncologists? Just in your side, there's like 3 more.
Have
I interviewed all of them? I feel like I have.
In Guam or at GRMC?
GRMC.
In GRMC, I'm the only oncologist. There's a radiation oncologist,
right?
And there's a surgical oncologist.
I met him.
Yes.
And then it's you.
And I'm the only medical oncologist.
Okay.
Yes.
Well, and those are the only 3 in that specialty of cancer, right?
Yes.
It's just the 3 of you.
Yes.
And so, do you float between all of these oncologists, or you're just department wide, or is that just you specifically tend to the Dr. Cheruvus?
We just tend to Dr. Cheruvu.
Oh, okay, all right. Well, then you guys are working pretty hard. Then, can you tell me what the move was like to Guam? You came from where?
I came from Cincinnati. Lived in Ohio for 8 years. I did my residency and my training there, and then I practiced there in a private practice for 2 years. And so I was a part-time physician, part-time oncologist after I got out of training because I had 2 little ones. And I wanted to spend time with them. And then after they were like 2, my youngest one was 2, I decided to become a full-time. And as I was searching for jobs, I came across the Guam opportunity. And I thought it was just an interesting thing to do, different culture, like different social culture and different medical culture.
Are you closer to home?
Somewhat, yes, yes. I mean, distance-wise, I'm closer to home, but time-wise, it takes me longer to fly there.
Yeah, because you have to go to you have to go all around Asia.
Yes, that's true.
Just to get there. Do you have much experience about cancer in this part of the world, in this region?
No, and that is another thing, because some cancers are kind of endemic to Southeast Asia.
Right.
Like the nasopharyngeal. And then our Japanese patients, there's an increased incidence of gastric, stomach cancer. Also, the liver cancer here is more than we see in the States, because hepatitis is more, the incidence of hepatitis here is
really
more. Yeah.
Why is that? What are the factors for
I really haven't looked into it.
Okay.
But hepatitis B, there's a vaccine for hepatitis B.
Right.
I'm not sure if everybody on Guam is vaccinated for it, but that I think could be one of the factors.
Greg, where did you come from?
I came from Tennessee.
Oh my goodness gracious! And what did you come here for? Is this the reason why you were brought here?
No, actually, I initially came to work in the emergency department. I worked in the emergency department for about a year, two, and they were needing someone in clinic, so I moved from the emergency department over to the clinic.
Well, what would bring you to Guam? Was it
Warm weather.
Okay, well, I mean, what you know and most Tennesseans don't know, I guess. You were the first one to make it out of the state just for the warm weather. Yeah. But what about the market here? Nurse practitioners is a growing industry, and it seems so because in support of medical doctors, then would it be safe to say that clinics are likely to hire more nurse practitioners for just regular general family care, as opposed to having more doctors on staff because it might be
cheaper?
I was going to say that, but I don't want to devalue your value. You know what I mean? Because it would be more efficient, wouldn't it? Depending on what the needs are of the patient in a particular clinic, right?
Sure.
Yeah. But the industry is growing.
It is. The legislature, they're working on legislation to update the nurse practitioner role here on Guam to, catch up with the U.S.
What's the difference?
Well, right now, on Guam, you have to have a collaborating physician in order to practice.
Oh, I see.
About half the states in the U.S., including Saipan, you do not. You can have autonomous practice.
So you can open up your own practice if you want to, or?
Well, I guess you could in an autonomous environment.
Well, he's not going to say yes as long as he's under your payroll. I guess that was a lousy question, Greg. We'll talk off the air. No, I'm kidding. But the industry is growing. I didn't realize that it would be hampered because you have to be associated with a medical doctor, licensed to practice on Guam. Interesting.
Yeah.
Well, that would open up an industry, wouldn't it?
It would bring more nurse practitioners here because, we tend to go to states where there is independent practice after you're experienced and that kind of thing because it's just a better work environment.
Right. But you came to Guam. Well, because of the warm weather.
That's part of it.
Part of it. Well, I mean, it is beautiful. I imagine that you have not had this winter like this.
Never.
And they haven't had winters like they have had over there either. It's been pretty bad. Is there anything about Guam other than the higher cancer rates and the specific cancers that you see in the 6 months that you've been here that is remarkably different than what you thought it would be?
Well, the patients themselves, they're very appreciative. That's unlike something that that's something that I've never seen stateside. Number one. Number two, some of the drugs, as I've mentioned, it's harder to get those here because, we have to ship them from the States. So that is kind of it plays into the treatment options that people have here. If it takes some time to get a medicine to them while the cancer is progressing, I have to look at different things, like what can I do while we're waiting for that.
Yeah,
I didn't run into a lot of those when I was in the States.
It is. Well, I mean, it's a smaller, more unique place, but you also probably have more contact on a daily basis with your patients.
Yes.
And we'll remember them because you might run into them at the market.
Oh yeah, that's true. I was telling him, and I just ran into somebody at the farmers market. One of my patients.
Yeah.
You keep
that's
running
kind
into
of
the
rare.
Kmart Payless.
Yeah, and it's kind of rare to do that any other place.
That's
and
true.
they'll take you to their house and they'll try to feed you. That's the other thing too. I'm sure you know this. Rowena, well, you come from the Philippines, and it seems to me that the nursing profession is the thing. I mean, what's the name of the comedian? What's the name of the comedian? What was his name? What's his name? Remember his mother told him she wanted him to be a nurse and he wanted to be a comic.
Oh, no.
Joe Coy.
Joe Coy.
Joe Coy. Yeah, Joe Coy. Do you remember him? Do you know Joe Coy, the comedian?
I heard his name.
Okay. Well, he has a whole bit. He has a whole bit that his mother gets upset at him because he is one of the few Filipino men who's going to study to be a nurse. Because all of his other relatives are nurses.
True.
They came to America to be nurses. So, I mean, you churn out nurses in the Philippines. They must have must have really good education.
Yeah. And plus the training actually is very extensive. So it's pretty good experience for the students and for us to be like really wanting into the business. Actually.
Yeah. So why did you want to come to Guam? I know it's a loaded question.
I know. I used to work in New York before, but when I got the chance to work in Guam, so it's an awesome experience. So why not grab it? Like,
no kidding.
It's closer to Philippines,
right? Now, is in New York? Were you working? Where were you working? In an ER, or were you working?
I was working at the oncology hospice.
Okay.
Actually.
All right. So
that was my basic experience.
Yeah. Well, I'm glad you're here.
Oh,
I'm glad you're at GRMC, and I'm glad you're here. It's 6 months in, and
I'm enjoying it.
You're smiling. That's not bad. Greg's got a constant smile on his face. Well, thank you so much for coming in and talking to us. I know that we're going to probably do another round or something. We concentrate a lot on oncology here because they're, for obvious reasons, like you say, the higher incidence of cancer on Guam than any other place that you've seen, which is, not anything to brag about, but it is clearly the more you're educated and aware, like you say, preventative medicine or finding these things out before can decrease the amount of years that you're battling it. Right.
I have to add that when we talk about the cancer incidence, it's not just the endemic like Guam population. There's also the whole of Micronesia. So people coming from Chuuk, Yap, they also don't have good screening procedures like cervical cancer, pap smears, things like that. And I see a lot of cervical cancer coming from the smaller islands.
And okay, well that's a good point to make because Guam is not necessarily people who live in Guam. The statistics are just in this region, in the Micronesia region. Jack's got a question for you. I hope you don't mind, if you wouldn't mind taking it. Hey, Jack. Good morning.
Oh yes. I just caught the tail end, and I guess part of my question was answered. I was going to ask whether they mentioned that there's an increased cancer rate here in Guam compared to the mainland, but I was wondering, are they keeping track between the sexes? Like, is it more increased on the women's side than it is comparable to the men's side? Hello?
Go ahead. Did you not hear the question?
No, I couldn't hear it.
Here, turn it up right there. I don't know how that we were doing that. I'm sorry. Jack, you wanted to compare between the genders?
I heard the response about the cervical cancer. So my main question was, have they been keeping track on whether between the sexes, if the increase is more on the women's side as compared to the men?
Yeah, I do not have access to the most recent data. The only data that I have been able to look at was back in, I think, up to 2007, like 1999 to 2007. And in that period of time, men did seem to have a slightly higher risk. And that goes with like the national data in the United States. Men seem to be at a slightly higher risk than women.
Okay, that's over 10 years ago.
Yeah, what kind of cancers? What kind of cancers are they? Hold on, Jack. 1 second. What kind of cancers are men getting?
Men usually have a higher risk for lung cancer, so lung and prostate.
Okay.
Yeah, because I think we had a discussion about this a couple of months ago with the women's conference about women's cancer and whether or not oral contraceptives, the increased use of had probably a cause and effect with increase in cervical, breast, and women-related health issues.
Yes, and I think there was a recent study that came out, about looking into the use of oral contraceptives and the incidence of breast cancer. And the bottom line was that there's no real proof, or there's no real cause-effect thing between the oral contraceptive pills and breast cancer. I can't talk about cervical cancer. I don't know about that data. But I was kind of surprised to see that data come out of that big study too.
Yeah. Okay, so I just wanted to check on.
All right.
Thank you.
Thanks for the call, Jack, and thank you, Doctor. We appreciate your time. Rowena, it's very nice to meet you. Greg, nice to have had you here as well. Thank you so much. About 3 minutes now before the top of the hour. That was Your Healthcare Partners, brought to you by GRMC, where patients are partners.